My name is Captain Dawn Sellers. I am a 66 Romeo, in civilian terms is a psychiatric mental health nurse practitioner. I am here with the UAMTF 0051 out of Fort Gillem, Georgia. So behavioral health for this mission consists of social work or social workers who are therapists, the psychiatric nurse practitioners, and psychiatrists. Here at Elmhurst, we are supporting and supplementing the behavioral health staff who is already here. We have the opportunity to complete psych consults in the ED for behavioral health patients. We have the opportunity to support the psych staff in the psych emergency department. And we also have the awesome opportunity to join the care coordination program, where we connect families with patients virtually via FaceTime platform or Skype. Some of the occurrences that I've seen have been unsettling at times, but mostly I've been heartened by the humanity that's shown, by the unity that I see in the staff, and even with the family who are encouraging the staff, who are encouraging the patients to get better. So that has really moved my heart to see the unity. Most of the challenges that I've faced have been actually internal, and it's mostly coming face to face with my own mortality and the mortality of the loved ones that I leave behind. So in a medical emergency or crisis, people usually think about physical medicine. They don't think about holistic care and the effect that it can have on people's psyche. They don't usually consider psychiatry an essential part of the mission. So to be included and have my skill set as a psychiatric nurse practitioner used and valued makes me very proud that they are thinking holistically about this mission. Well, as a psychiatric nurse practitioner, I feel that I have the best of both worlds. I can practice, I can prescribe, I can understand the biological and pharmacological implications of suggested treatment and recommendations, and I can understand psychosocial implications that are here in a, again, medical emergency. And I am able to compile that and use that to serve the patients and the families from that perspective. So some of the results I've seen with behavioral health being here: one, we're providing support again to the psych residents, the Department of Psychiatry, and they are not as overwhelmed. They're very grateful. They weren't expecting the help, and they are very grateful for the help. The other is with the Care Connection program. It is not a program that has been traditionally offered, because family members can normally come and see their patients, or the patients or their loved ones. And with the COVID virus or coronavirus, they aren't able to come. So being able to offer them a virtual visit seems to lower the anxiety of the family members who are concerned about their loved ones and unable to see them. It seems to lower the feelings of helplessness because they can see them. And it also seems to lower the anxiety of the patients who are otherwise suffering alone. So it helps, we are able to help the patients to not feel as alone while they're suffering with this illness. So So what I am very impressed with is we have a team. Normally, when I go on a mission, even a mission trip, there is usually, psychiatry and behavioral health is like an afterthought. So then you'll end up with one provider. But we have a team. So we are able to be there for one another. We're able to help with stress management with one another. We're able to debrief with one another so that we can be whole and healthy, to be able to be that ear for our fellow soldiers and to be able to be healthy and whole to provide the care and be completely present to provide the care for the patient. Your psyche, your emotions are a part of you. You are not compartmentalized. Your body is a whole. So things that affect your physical body will affect your emotions, will affect your psyche. And if you don't share, if you don't vet it, if you don't let it out, it will affect you physically, and it will impair your ability to complete your mission. It will impair your functionality. Just as you do preventative care for your body, you go to the doctor for your physicals. Behavioral health should be a part of your preventative care, because a healthy mind facilitates a healthy body.